Heart disease remains one of the leading health threats in this country, but knowing the risks and recognizing the signs can save lives. And today we're joined by Dr. Sujati Agnani, a cardiologist with Optum Washington, and she's here to walk us through the top risk factors and the red flags that really deserve attention. And first, I want to know how long you've been with Optum.
I've been with Optum for 15 years. I've been a practicing cardiologist in Everett, Washington.
Amazing. Congratulations there. So let's start to a little overview. What is coronary heart disease?
So our heart is a pump. It's muscle that pumps blood all over the body. And our heart requires its own blood supply. And so the blood supply to the heart comes from small arteries called coronary arteries. And these arteries, they can get cholesterol plaque buildup in them. And when that happens, it leads to stiffness and narrowing of the heart arteries, which then can lead to symptoms of angina, and in a really serious situation, it can lead to a heart attack.
I know I want to talk about all the risk factors that you really want people to pay attention to as well.
Yes. So risk factors, there are some non-modifiable risk factors like a person's age or their family history. But fortunately, there are risk factors that we can also work on and modify. Those risk factors tend to be hypertension, high cholesterol levels, diabetes, lifestyle choices such as smoking or being sedentary, being overweight.
Okay, talk more about the lifestyle change. Should we be working out a certain amount a week, looking at our BMI? What should we be thinking about?
Yes, so I tell my patients to focus on three main factors. First and foremost, nutrition. Be very mindful of what you eat. Try to avoid processed foods, eat more fresh fruits and vegetables, leaner meats, low-fat dairy. Try to avoid trans fat, saturated fat, refined sugars. So be mindful of what you eat is very important. And then going with your Olympic theme, it's important to get 2.5 hours of physical exercise per week.
Ooh.
So most adults don't get that amount of exercise, but the American Heart Association recommends 2.5 hours of aerobic activity such as a brisk walk or cycling or any activity that you enjoy, and an hour of resistance training also per week.
Wow.
So yeah. So in addition to those two factors, the third factor is emotional well-being. Because it's really important for us to make good, deep social connections with others and get enough sleep, because that reduces your stress levels.
And are you talking like 8 hours there for like a good night of sleep, or what do you recommend?
Yes, so about 8 hours. When you wake up in the morning, you should feel rested. You should feel rejuvenated.
Okay, well, I need help on that for sure, but I love those tips. What are some warning signs too that people should be looking for?
Yeah, so the classic warning signs are, of course, crushing chest discomfort that can go to your arm and make you short of breath. This can come with physical activity or with emotional stress, but many a times it may not be the typical sign, especially so in women. They may feel symptoms a little differently. They may get jaw pain, neck pain, upper back pain. They may feel nauseated, dizzy, or extreme fatigue is another sign, not being able to do the activities that you like doing, running out of steam. So pay attention to your body. If
so
you
is
get
this like
these
a warning sign for like a heart attack is what we're talking
that
about?
there are blockages starting to build up and you need to be evaluated.
What about for a stroke? What are the warning signs there that we should look for?
So a stroke essentially comes on suddenly, and you may feel difficulty in speech, and you may feel weakness in one half usually of your body, tingling, numbness, difficulty walking, difficulty with vision. And the main thing to remember is that time is very important when it comes to a stroke or heart attack, because there are certain therapies we can deliver quickly, which can save muscle and save brain function. So.
And before we leave, I want to talk about the screening and tests that people can do with their doctor. What should we be talking about?
Yeah, so it's really important to, when you go for an annual exam, to talk to your doctor about your numbers. So what we mean by knowing your numbers is what is your blood pressure, what's your target blood pressure, what's your blood sugar, your cholesterol running like, what's your ideal body weight. So start with those basic facts, and subsequently if you have a lot of risk factors, you can go for a CT calcium scan, or if you have symptoms, your doctor may recommend a stress test.
Wow, you gave us all the information today. Thank you so much for being here. This was really great.
Oh, thank you so much for having me.
Yes. And to learn more about the care and support available through Optum Care Washington, just head to the website that you see right there on your screen.
New Day Northwest is sponsored by Optum.